Hello everyone, welcome to the channel. So in this video, we'll understand the risks which are faced by the various health professional and we'll see how to prevent them. We'll be discussing various hazards under following headings like biological hazards, chemical hazards, ergonomic hazards, radiation hazards and psychological hazards which are faced by healthcare professional. First, we'll talk about the biological hazards which are also known as a biohazard. That refers to the infectious agent or the biological substances that pose a threat to the health of humans. So, as a healthcare professional, we are routinely exposed to the blood, body fluid, respiratory secretions, stool, urine, or the vomitus of the patient. We are exposed to the contaminated needles and shaft, and also to the infectious waste and inadequately sterilized instruments. So, these are the common sources from where we can get the infections. At-risk healthcare workers include not only the doctors and the nurses, it also includes lab technicians, waste handlers, cleaning staff, dental professional, OT staff, emergency responders, and other people who are involved with the patient care. The various biohazards can be transmitted through various routes of infection, like from percutaneous, the HIV, hepatitis B, hepatitis C can be transmitted, or if there is a mucosal exposure, similarly, along with them, the influenza, SARS-CoV can also be transmitted through the inhalation route. Tuberculosis, measles, varicella, SARS-CoV can be transmitted. If we are not following the hand hygiene properly through ingestion, salmonella, hepatitis A, E. coli, that kind of bacteria and viruses can be transmitted through the skin contact, through fomites, the MRSA, VRA, scabies, fungal infection can be transmitted, and through environmental contact, we can also get infected by influenza, Clostridium difficile, or norovirus. There are various prevention strategies which need to be followed to prevent ourselves from the biohazards. First is the standard precaution, and that is applicable to all the patients regardless of their infectious status. We need to perform hand hygiene with either soap and water, or if soap and water is not available, we need to use alcohol based rub. We need to use the PPE, including gloves, gowns, mask, and eye protection. Safe injection practices include the single use syringes, no recapping of the needle, and hand hygiene to be performed before and after giving injection, and proper disposal of needle and syringe after injection. And there should be safe handling of potentially contaminated equipment. So these are the 5 moments of hand hygiene which are recommended by the WHO. That is, first, before touching the patient and before doing any kind of procedure. Then if you are exposed to any of the body fluids of the patient, after touching the patient, and if we have come in contact with the patient surrounding. So we can remember these 5 moments of hand hygiene, like before and after touching the patient, we need to do hand hygiene. Then if we are doing any procedure, if we have come in contact with any of the body fluid, and after touching the patient surrounding, we need to perform the hand hygiene. Secondly, prevention is based on the transmission pattern, that if the transmission is through airborne, we need to use N95 mask or negative pressure rooms. If the infection is transmitted through droplet, then we need to use surgical mask and we need to isolate the patient. If the infection is transmitting through contact, then we need to use gloves, gowns, and disinfection practice need to be followed. Then vaccination is very important for healthcare professional. Hepatitis B, influenza, COVID-19, and the tetanus vaccine are mandatory for every healthcare professional. So other vaccination will depend upon the exposure of the healthcare professional. That, for example, if the healthcare professional is working in pediatric ward, then MMR, varicella may be required. Adequate biomedical waste management is very important to prevent the transmission of biohazard. That in segregation at source is important. We need to use color coded bins and safe disposal method like incineration and autoclaving. For the needle stick and the sharp prevention injury, we need to use a safety engineered devices. There should be no recapping of the needle. There should be proper sharp disposable bins and immediate washing if there is a sharp injury. And these incidents are need to be reported, and the post exposure prophylaxis is given depending upon the exposure, and then the medical evaluation and follow up is required. So this is a summary that most common transmitted biohazards are HIV, hepatitis B, hepatitis C, and other. The major routes involve the bloodborne, airborne, or through the contact. Preventive measures include hand hygiene, PPE, vaccination, training of the staff for infection control practices. And if there is exposure, then we need to give post-exposure prophylaxis, medical follow-up is required, and documentation is also important. Coming to the chemical hazards in healthcare, these include the potentially harmful substances that are being exposed during the course of their duty, and that may lead to the acute and chronic health effects. And the exposure may vary, like it can be acquired through inhalation, for example, fumes from chemicals like formaldehyde and acetic acids. It can be acquired through dermal contact, through spills, splashes from the disinfectant or the cytotoxic drugs. And rarely, but inadequate hand hygiene can lead to ingestion. And the other route involves accidental needle stick injury or injury during drug preparation. So this is a list of various chemicals which the healthcare professionals are usually exposed uh, during their work, and these chemicals are being utilized for various purposes, like for disinfection of instrument or for the tissue preservation, or there's the uses of or in OTs, or during housekeeping, disinfection, and these are the various hazards which may occur after the exposure. You can see that they can act as an irritant. Long-term exposure can lead to carcinogenic effect. They may act as a seen as depressant or can lead to the allergy. High risk worker for the chemical hazards include the staff who is working in the OTs, sterilization, oncology wards, housekeeping staff, the staff who is working in the radiology department. So this slide summarizes the health effects of the various chemicals according to the system affected, and you can see there is a various health effect can occur, like if respiratory system is involved, it can lead to asthma, bronchitis, hypersensitivity, pneumonitis. In skin, it can cause dermatitis, burns, eyes, it can cause irritation, conjunctivitis, and in long run, reproductive system can also be affected, leading to the infertility, or if the female is pregnant, it can lead to congenital anomalies. So what can be done to prevent the chemical hazard? First is there should be use of proper person protective equipment, using of gloves, goggles, lab coats, aprons, respirator and mask if required. Second thing, there should be proper storage and labeling of the various chemicals. It should be placed in the well ventilated and the designated areas, and the flammable should be separated from the other chemical agents. What can be done if there is an injury, that immediate decontamination if the person is exposed? Training should be there of the staff on the safe handling and the storage of these chemicals. Spill management protocols are there in every hospital, and what is to be done in case of spill, isolate the area, ventilation, reporting, and decontamination procedures are done in case of spillage. Coming to the psychological hazards which are faced by the healthcare professional, various risk factors include long shift hours, workplace violence or the abuse, and moral distress that can lead to the mental health disorders. So, what can be the coping mechanism or the preventive measures which can be taken to manage the psychological hazard? It will depend upon the hazard or the stressor. Like for long working hours and workload, there should be duty roster management, adequate rest break should be there. And for burnout and compassion fatigue, regular debriefing sessions are required, peer support group should be there, and there should be promotion of work life balance. For the violence and abuse from the patient or the relative, the training in the communication skill is required. There should be more security measures in the hospital, and there should be zero tolerance policy towards any kind of abuse or violence towards a healthcare professional. For emotional strain, counseling services are required, mentoring is required, and team building activities, mentorship program, these are being required for isolation and if the healthcare professional is feeling lack of support. And there should be awareness campaigns, and there should be access to confidential mental health services so that the stigma around the mental health services can be removed. And even in today's time, even after having so many helpline, there are a lot of suicides we are seeing in the news, and the people are not ready to take the mental health services. Then comes the physical hazards. In physical hazards, they can be radiation exposure, noise hazard, or they may be slip or trip or fall. Talk about the radiation exposure in little bit detail. The sources of radiation includes the diagnostic radiology, intervention radiology in cardiology department, nuclear medicine department, OTs, dental radiography. All these are the sources of radiation exposure to the healthcare professional. And the health effect of ionizing radiation can be of different type. It can be of deterministic effect, that is known as a threshold dose dependent, that occurs after high dose exposure, that include the skin burns, radiation sickness, or cataract. There can be stochastic effect, that is no threshold is required. It's a long term effect that includes the cancer, leukemia, or the genetic mutations. Reproductive effects are there leading to the infertility, miscarriages, fetal abnormalities, and particularly in the pregnant staff. For minimizing the effect of radiation, the ALARA principle need to be remembered. Full form of ALARA is as low as reasonably achievable. Three things need to be considered in ALARA principle, that is time, distance, and the shielding from the radiation. So less is the time, less is the radiation received, more is the distance, less is the radiation received, and there should be shielding from the source so that less radiation is received. So as we minimize the time, we have to use quick and efficient technique, and we have to avoid the repeated exposure to radiation. The radiation exposure decreases exponentially with distance, and stand at least 6 feet away from the sources when possible. For shielding, we use lead apron, that thickness varies from 0.25 to 0.5 mm. Thyroid shields are being used, lead glasses, mobile LED screens are being used, and there should be structural shielding in the radiology rooms to prevent the transmission of radiation. So thermolucent dosimeter, ring dosimeter, film badges, these are the various devices which are used to measure the cumulative exposure and required for the monitoring of how much radiation exposure have been occurred to the healthcare staff. To summarize, radiation exposure, we need to follow ALARA principle. Personal dosimeters are required. The healthcare staff should maintain exposure logs, and rotation of the staff is very important so that not a single person is exposed to the radiation continuously. And pregnant healthcare workers should be protected from the exposure to the radiation. So for this, regular training and awareness of the staff is also required. Coming to the ergonomic hazards in healthcare, these are the hazards of the condition in the workplace that put a strain on the body's musculoskeletal system due to either the poor posture or the repeated movements, forceful exertion, or the awkward position that leads to the musculoskeletal disorders. Being a healthcare professional, they are at constant risk because of the frequent patient handling, long working hours, non-adjustable furniture, repeated tasks, and the poor workstation design. The common ergonomic injuries in the health worker include lower back pain, lumbar strain, and it may also lead to the cervical spondylitis, carpal tunnel syndrome, due to long-standing work requirement like in surgeries, OT staff, that may lead to the varicose vein, joint strain, and plantar fasciitis from prolonged standing. There are various high risk activities in healthcare that may act as a ergonomic risk factor, like lifting or transferring the patient, prolonged standing, sitting for long periods, repetitive testing, particular type of movement is being done repeatedly, and moving equipment, prolonged computer use, poor workstation ergonomics. So all these are high risk activities which are involved in healthcare, leading to the MSDs. Prevention strategy include the training in the body mechanics. Second is the use of ergonomic equipment like adjustable chairs, tables, footrest, and if possible, patient lifting devices should be there. Job rotation is very important to reduce the repetitive strain, and the micro breaks are required every 30 to 60 minutes. And the staff should perform stretching exercise regularly to prevent the musculoskeletal disorders. Workstation design is important. Patient handling aids are very important if the regular patient handling is required to prevent the ergonomic hazards. In management, there should be access to physiotherapy or occupational therapy. Job rotation should be there, and if there is an injury, we need to modify the duties. And regular breaks are very important to reduce the strain. So this is a summary of ergonomic hazards. What are the risk factors? How to prevent them? And if there is an occurrence of MSD, how to manage them.